Hey everybody, welcome to my channel. Today we're talking about how to treat a vaginal yeast infection. I'm your doctor, Dr. Perkins, OBGYN, and I'm excited to dive into this topic because yeast infections are quite common. So in this video today, you will learn what exactly is a yeast infection, the symptoms that you should know regarding yeast infections. We'll review antifungal and natural treatment options for vaginal yeast infections. And then we'll dive into a few tips of how to prevent a future yeast infection once you've successfully completed a treatment. All right, so let's dive into what exactly is a yeast infection. Know that yeast infections are extremely common. Most reproductive females at some point may have a yeast infection, and maybe once, twice, or even 10 times in her lifetime. They are extremely common. And so a yeast infection is caused by a yeast, okay? But really a yeast is a fungus. And that is what we want to take away from this video today, that this is a fungal infection that is very common. And so the species that is more responsible, I would say, for these infections are called Candida. Candida yeast infection. And so medically, you may hear the term candidiasis. It's an infection caused by Candida. And it means that your vulva has an infection caused by this specific strain of yeast. All Candida are not created equal. I'm always comparing things on my website or on YouTube here, but the reason is our pictures individually and our infections and what we experience may not mirror each other completely. And the same thing happens with a vaginal yeast infection. What we know is more common from person to person are the symptoms. We know that you may have and will have a change in your vaginal discharge. Normal discharge can be clear, it can be slightly whitish but thin. It can be a little bit yellowish as well. And this may change during your menstrual cycle. That means the time from one period to the next period. And so as we go through, hormonal changes or discharge will change along with that. But those changes are pretty predictable. From cycle to cycle, your discharge may look the same in the first week of every cycle. When you ovulate, your discharge may look the same every single month. Those are predictable changes. If your discharge becomes very thick and what we refer to as cottage cheese-like, that is usually indicative of a yeast infection. And I'm going to show you exactly what that may look like. So here we have some cottage cheese. And what you can notice here is that this is not very smooth textured. It is a little bit thicker in places and lumpy bumpy. This is cottage cheese and it really closely resembles the thickness that can happen in your vaginal discharge when you have a yeast infection. So if your discharge has now become that thick and clumpy and lumpy, then you may want to see your doctor so that you can get a diagnosis and check to see if that could be due to a yeast infection. You may be thinking that if my discharge changed to look like that or something close to it, shouldn't that mean that I should have a lot of symptoms? And you might not. Yeast infections, they don't necessarily come with like pains in the vaginal area compared to bacterial vaginosis that may come with a smell, like a fishy smell. You might not smell any different. The only small clue that you may have may be a change in your discharge. Now, there is like another subset of patients who don't even have a change to their discharge that they can notice, but they have an overgrowth of yeast. And so with those, the only way that you would find out is by doing some testing, like some lab testing that we'll do in the office for you. So what does that mean? For us to do these exams and do this testing, we need to see you in the office. I can't tell you how many times patients have tried to diagnose themselves, with whatever the infection is or whatever the changes occurred. They'll give themselves a diagnosis and say, yes, this is what I have. And because treatments are available over the counter, they'll start to use some of these over the counter medications when they truly don't have the infection that they think that they have. I say all of that to say it is important that testing be done for the reason of getting the correct diagnosis, but more so the correct treatment as well. Even though Candida is the fungus that is responsible for causing this overgrowth of yeast that we call vaginal yeast infection, there are different forms and strains of Candida. And depending on the one that you have, you may need a different treatment plan. Sometimes I've had patients say that, I've used a monostat 4 or 5 times and I keep getting this infection. And sometimes it's because the version or the strain of Candida that you have is not being accurately treated by the medications that you've tried. And so working with your doctors, getting tested and getting a sample sent off to the lab is super important for you to get an accurate diagnosis. And on that note, treatment is available over the counter. You can find this in a local pharmacy. So if you're in the United States, there is Target and Walgreens and Walmart and so many different places where you can get your treatment. How do we do that? That is the focus of our video today. I'm going to dive into that. If you'd like to treat on your own over the counter, there are lots of different options. What you're looking for is an antifungal medication. Okay, this is a fungus. We need to fight it, antifungal. I'd like you to know a few things. The first thing is that fungal treatments end in azole, A-Z-O-L-E. So miconazole, fluconazole, these are antifungal medications. So if you're in the pharmacy and you're looking at treatments and you're just like, but this says monostat, the generic name will be on that packaging and will tell you the type of azole that you are getting treatment with. And it's important that an azole is included in your treatment because if not, that is not a true treatment of your yeast infection that you have. There are so many things on the market, and so we have to be very, very careful and make sure that we're getting the accurate and correct treatment necessary. And so I have a few examples, okay? Now I'm not working for any of these companies, just to let you know, but these are common treatment options on the market. Monostat is one of those, okay? This is a monostat 7. Important things to know, monostat doesn't include the name, here it is, there you go. Monostat 7 doesn't say azole, right? But if we look below on the box, it says miconazole nitrate vaginal cream. Azole is at the end of that first word, so that's the active ingredient and it's an antifungal medication. And because we're talking about vaginal yeast infections, we're not talking about yeast infections of the mouth, like a thrush and other places. It says vaginal in the name as well. So you want to look out for that. The 7 in the name, it refers to the amount of days that you'll receive treatment for. There are monostat 1, which means it's 1 day treatment. It doesn't mean the yeast infection goes away in a day. It just means that the amount of times that you have to give yourself the medication is 1. So just 1 night. This monostat 7 means that for 7 nights in a row, you should insert this cream, okay? Creams are available over the counter as well as suppositories. But I'm gonna show you a close-up of what this cream looks like. So inside of the package, you'll have a tube with the medication within it, looking something like that. Then you'll have applicators. And so these applicators, depending on the pack that you get, you may have 7 of them in the package. So they're one-time use, so you use this tonight, you throw it out in the trash, you get a new fresh one the next day. Sometimes you'll have only 1 applicator for the entire duration of treatment. And so if that's the case, you may have to wash the 1 applicator and reuse it each night, depending on if you have a 1, 5, or 7-day treatment. The applicator, I'm gonna put this down a second. The applicator moves back and forth as such. The reason is you'll fill it up with the medication, the cream. When it's filled, it's extended as such. You place the applicator vaginally. So if this is our vagina here, this is the applicator. We'll say that it's filled. You insert it vaginally until your fingers on the applicator, right in the end, you'll hold right at the end, but it's extended because it's filled. So we're gonna re-extend it there. So you bring your fingers until it hits the vulva, and then you insert the cream vaginally. Now it's important that you insert this applicator all the way in vaginally. If it stops halfway, the medication won't be high enough in the vaginal canal where it will work effectively. So you want to make sure this tube goes all the way vaginally. Insert the medication. All right, so I'm going to show you what the cream looks like now that I've shown you how to insert it. So oftentimes the tube should be sealed, okay? That ensures that no one's used this, and that is how it should be from the manufacturers. The back part of the top of the tube has a pointy little device, I'm gonna say a pointy area, that will break the seal on the tube. And then if we squeeze that, you see the cream is coming out. Okay, so I'm gonna wipe that off. And so what you'd like to do now is you'll take your tube and you'll insert it on the top of the tube, on the bottom of the applicator as such. And it's okay that the tube is not extended. What I like to do is just squeeze the tube from the bottom, and as it fills up, it's slowly happening, but do you see that tube extending? The applicator is now filled. I remove the tube from the end, cover it up, and now we have a full applicator ready to go. And this is where we'll insert that vaginally, squeeze all the tube on the inside, and then we'll get rid of this applicator. Now, as we treat with the cream, if you're having any itching on the outside of the vulva, which sometimes can come with vaginal yeast infections, what you'd like to do then is take some of the cream on the tip of your finger and then rub this on the outer parts of your vulva, the areas where you tend to feel some itching. And so this is applying cream and treatment on the outside area, and it helps to get rid of some of those residual symptoms that you may have down there. Now, this is just the first type of over-the-counter treatment option that you have in the form of a cream. And so now what we're going to do is that we're going to have a part 2 of this video where we'll talk about the other treatments that are available over the counter, as well as prescription options and how to prevent yeast infections once you're treated. And so join me in part 2 as we continue this demonstration.